procedure is called radiofrequency lesioning or radiofrequency ablation of the medial branch nerves that go to the facet joints. The way we do that is, first of all, the problem is when a person has degenerative disc disease, the discs break down. They're supposed to be big. And if you look at the joints that articulate in the back, when you don't have degenerative disc disease, the discs cause more space, or maintain the space between the joints of the facet joints, also called zygohypophyseal joints. As the disc breaks down, the joints break down, and then you end up with bone on bone. Patients usually feel pain in the lower back. It feels better when you sit down because they open up. It feels better when you're leaning against a shopping cart because it opens up. Men, it usually hurts them more when they're shaving because when they lean forward, it contracts the muscles of the spine and it crunches the joints together, and that makes it hurt. So it's more relieved by sitting down. And what we do is, you have the transverse process and your facet joint. In this little groove where you see that line is a nerve called the medial branch nerve. And that medial branch nerve comes out of this joint, goes along this groove, goes into the spinal cord, and brings pain sensation to the brain. What we're going to do is we're going to heat this nerve up at 80 degrees Celsius for 90 seconds. And what it does is denaturizes the protein in the nerve, and electrical impulse can no longer go through the nerve. Once we do that, the patient will not feel pain from this joint. However, this joint is innervated by two nerves. So we'd have to do two levels to de-innervate that joint. Thank you. Okay, now you do it. Pinch. Get that one there.
For his feet?
Yeah. Good. Pinch. Good. Pinch. More toward the feet. Good. Pinch.
Oh. Right there.
Yeah, it's good. Actually, rotate more toward his head.
Towards his head.
Right there, it's good. Last one, right? This is a numbing medication. These are the radiofrequency wands. We have to test first. At this point, we check and make sure that the needle is in the right position. We're testing motor to make sure we're not in the motor nerve that controls the right leg. If we're on a motor nerve that controls the right leg, the patient will get weakness in the right leg. We're treating just the sensitive nerve, the nerve for pain, for the facet joints. How you doing, sir? How do you feel?
Fine.
Is this an uncomfortable procedure?
No.
Okay. Testing it, there's no movement in the leg. So we're going to wait now. We're going to test, we're going to now heat up the nerves for 90 seconds at 80 degrees Celsius. And then we'll do the other side.
I like my stuff well done, all right?
Okay. Bottom one you shouldn't really feel. The third one, the top one just went on. So that you might feel a little bit. Oh, close. That's what I got. There. Back to the films. Okay, everything's off.
What's that, huh?
That side's done.
Where's the radiation coming
It's not radiation, it's radio frequency. It's radio frequency, like radio.
Yeah.
It's the same, but it's very high radio frequency.
And what's that for one time using that with yourself and protecting?
Yeah, then you get better reception with
No, this is radio frequency.
Put it in the middle again. Pull it up. Right there, it's good. Blink it toward me a little bit. Good. Pinch. Another pinch. Alright, good. Now just move the whole thing up so I can get both in the middle. Too much? Right there. Pinch. Last pinch. It's more sensitive the higher up you go in the back. Numbing medication. complicated.
That one? Okay. Let's see where we are.
Line up 4.
4.
All right, stop it there. Yeah, this is the bottom one.
Bottom one. It's too many. It's bottom.
4.
4.
3.
3. That one's the top. Alright, so start with 1.
Smartphones.
Kind of. That's this one here. Okay. 2.
It's moving the multifidus muscle. The leg is not moving, so that's good.
Okay, we're good. Alright, stop. And we hitch up now, so just remember.
Get that?
Check.
That was thorough.
Okay. 30 seconds more.
How long's the nerve last like that?
Anywhere from 6 months to 5 years,
Yeah?
depending on how fast your body heals that nerve up. Because of the fact we don't sever the nerve, but it depends on how fast you heal it up. Your body heals it up.
And he's cleaning up, we'll get you off the table.
Well done. Now this should take an effect. We put some local anesthetic in there so the patient should leave the office virtually pain-free. And then within another 3 or 4 days you should start to feel better and progressively feel better up to a month after. But usually we see the patient a few weeks later and they feel very good.